7. So CJ will lead the roll call.
Tony Mitchell. Will Ibershoff.
Here.
Cindy Potter. Dustin Hawkins. Jason Pollock.
Here.
Jeff Hurd.
I'm here.
Jeremy Green. Michael Baker. Nicholas Sneed.
Here.
Timothy Plummer.
Here.
Trent Titus.
Here.
We have a quorum.
I want to note that Chair Lepine and Penny Kudimo is excused from this meeting.
All right. Do we have anybody for public comments? All right, Karen, now would be a good time to speak if you could.
Hello, can anyone hear me?
Yep.
Okay, I saw Nick nodding his head. I don't have a hearing problem, but I can barely tell that the meeting is being recorded on audio. I can't hear a dang thing. Sorry. Is there any way to turn it up? I can't hear what you guys are saying. Can you hear me okay?
Can you hear me?
I can hear you.
About me.
Just speak close to the mic.
It's something that I always listen to the recordings via audio. I always have to wear headphones turned up full blast and able to make 90% of what's being said. So. Sorry, I'm not some crazy old lady. If you folks are ready, did you want to take my comment or did you want to do something else?
Yeah, we're ready. We'll take your comment.
Okay. So I heard on the grapevine that the folks at the shelter, the Madras shelter on Oak, up on the hill there, are being asked to leave between 4:30 and 6 p.m. so that they can reset and organize, I guess, for the evening. That sounds like a wonderful idea. However, they're being turned out during the very hottest part of the day. It's very, very hot. And I did get confirmation from Tony Mitchell that this is what's happening. And I asked him in another message subsequently if they were allowed to hang out under the eaves in the shade of the building. I never got a response to that. My other question is, I see it's being designated not only as, you know, the homeless shelter, but right now during the heat event that we're having, which will continue for 2 to 3 more days and get a little hotter even tomorrow. They are going to use the homeless shelter just for any people, even people that are housed that don't have an air cooling system in their house. Is that correct?
Okay. Karen, this is Tony Mitchell.
Tony?
Let's start with the first. It is true that there needs to be a small, as I responded to you via text, there needs to be a small break in between the cooling shelter and the start of the evening. We have
I get that.
certain things. Yeah, if someone wanted to hang out under the overhang of the building, they're free to do so. One thing that it would be profitable for you to know is we have very few people that are choosing to stay between the hours of 12 and 4:45. We have people that come in and they get a meal and then they leave. So the fact that we need to close for an hour to 75 minutes. Obviously, the population is fairly resilient because they don't, by and large, with a few exceptions, they don't take advantage of being in the cooling center the entire 4 hours and 45 minutes. And in fact, when I think back on previous seasons, that's always been the case. So I do not feel that it's anything that we're doing to be able to limit their access during critical hours. It's the population, in fact, tends to come and go. There's very few people that will actually come to the shelter
Okay.
and stay throughout the period. So that's probably something that probably is good to know because there's a coming and a going anyway. Yeah, so if, we were on our quote unquote break and they wanted to hang out under the overhang, they're free to do so. In fact, we have a limited amount of people that are choosing not to come into the facility, but to come and hang out under the overhang, them
Right.
and their animals, even though they would be welcome in the shelter. So yeah, I think we're the final thing that I want to say is we're doing everything that we can to provide the fullest, access during the heat emergency. And then, of course, after a bit of break, after Wednesday and we resume Monday, we will be open 5 days a week through either September 1st or September 15th, regardless of what the heat is. So we have definitely ramped up services in terms of a cooling shelter.
Got it. So is it, in fact, is this something that the county and the city are advising people to go hang out during the day there if they don't have, like, say, air conditioner or good enough fan or cooling system?
That is, yes. And as in previous summers, if someone is in an apartment or a home and they were to not have sufficient HVAC in their home, they're more than welcome to come to the shelter. That's always been the case. The shelter itself primarily exists to serve those experiencing homelessness in Jefferson County, but we don't screen. If you came in, well, are you houseless or are you not? We will welcome you. We will give you lunch.
I'm just looking at in
Yeah.
terms of
So
like
it's-
optics for people
yeah.
that are sheltered, that have houses, that perhaps they may not want to go to that homeless shelter just because it's a homeless shelter. And I was wondering if there was an alternative, like any churches or say like the community center, the county community center could be opened up.
Yeah, this is Mike with Public Health. Can you hear me? Maybe not.
Is it Michael Baker?
Correct. This is
Hi,
Mike. with
I
Public
just
Health.
I called earlier today to find out, and they're directing people to the homeless shelter. So thanks. I can hear you better a little, I think.
Yeah, so as of just a couple hours ago, in partnership with Mosaic Medical, for those individuals that do not want to participate in the resources with the Homeless Resource Service Center, and really focusing on those that are medically fragile but housed, we will be opening up the community room there at the Health and Wellness Campus.
Oh, yeah.
building- The building that's shared by Mosaic Medical and
Right.
Public Health. So that'll be open, mostly staffed by Mosaic Medical staff, but in partnership with Public Health. So there is a new resource there. We had made previous arrangements with the city to support as a backup model as well. So there's that. And then as of this weekend, we're working in Public Health, and we can touch on this a little bit more during the meeting. We're working on a distribution way to get portable AC units to those individuals that qualify. We can get them set up with an in-home portable AC unit to help kind of keep them there, especially those that are medically fragile or have underlying health conditions that can be impacted by the severe heat. So we're trying to do a multi-prong approach to address into the heat within the community, not just taking advantage of the new resource with the homeless resource center, but also working multiple approaches to make sure that everyone that needs the support is able to receive it. So I hope that answers your question.
That sounds great. Are you guys gonna post that on social media? Because I couldn't find anything this morning when I was poking around.
I'm surprised it's not. I'll check in with the Mosaic staff to see what they're doing, and then we'll share that message as well.
Okay, if it is, I'll go to the Mosaic page and I'll share it, some community pages. So thanks, everybody. Thanks for what you're doing.
Thank you, Karen.
And if you guys could do something about your audio, I don't know, it's probably something to tweak in the Zoom, settings or something. Seriously, it's really hard to hear it. Thank you.
All right, thank you. All right, jumping down to the regular agenda, report on count of homeless youth in Jefferson County.
So this is my first day back. I don't really have a whole lot to report on this. You want to give us some background here?
Well, at the time we created the agenda, we didn't have the count for the homelessness youth in Jefferson County. After conversation with public health, we learned that Homeless Leadership Coalition is working on updating their point in time count. So once we have those data, we'll be bringing it back to the committee and presenting it. Tony, I know you are on the committee, if you have something to add.
I do not.
So with that, we can move to the second agenda item if there is no further discussion.
So working with Lapine to see if there's any existing data with some of our partners and stakeholders. I still haven't reached out to FAN or Neighbor Impact. I did reach out to JBAR-J, but they directed us to connect with Neighbor Impact. But as of right now, it's really hard to get the youth data, which tells us that we could potentially be doing a better job at collecting it. So that's something that I'm hoping support at this time. So
I would add that Eco Northwest reached out to the Jefferson County 509J School District to set up a meeting with the FAN advocate to get an understanding of what the youth homelessness is experience or numbers are in this public school system. So with that, undoubtedly, there's some data associated with that. So I could share that.
the point in time count that I saw where it was youth involved with the family statistics, it doesn't go enough into detail to figure out what that entails exactly. And then I had a few concerns for potentially data that would be duplicated if we're not collecting unique IDs. So I also reached out to the CCO or Pacific Source to see if that's anything that they are collecting, because statistically that would be a really helpful data partner because they collect unique IDs.
Yep.
Not duplicating.
Also, there's a youth liaison at the school you can call and talk to. It used to be Kaylee, but she's taken another position, so I'm sure they've filled it by now. But she works strictly with homeless and trying to keep them in the same school system. And
As for agenda item, it's like what, 4.2, the collaboration between Jefferson County Faith-Based Network, Best Care, Jefferson County Public Health. Will, do you have anything to report on this?
Well, I know, and I was gonna look back to Best Care and Tony at the Faith-Based Network. I do know that they have met and they've talked about staffing a navigator, I believe. Correct me if I'm wrong, at the shelter to help with some of those folks, but you know better than I do because I didn't go to the meeting.
And I think we'll see some positive change, so.
So what's been created is a weekly schedule, if you will, to have Best Care staff members in from the burn program, staff members associated with housing and such that will have certain office hours, if you will, or hours at the Shelter Services Center to be able to, interact with clients over a variety of services that Best Care provides. It actually started On Sunday, we had a couple folks in for a couple hours, and though the numbers were low, they were actually sitting at the table mingling with folks. And so we really appreciated those Best Care staff members. So Heather has worked with Michelle Elliott. I think she may have had a little bit of conversation with Cindy. So Best Care has created a schedule for that. Michael's team has a day every other week where one of the public health nurses will be there in the parking lot with a van to provide services. Mosaic has an every other week schedule, but due to the size and the inability of the van to successfully navigate, in the parking lot and such, they're going to still use the loop that I understand that they have key access to or code access to be able to drive into the loop and where they can be accessible to the population. So we are really beginning the process. Some of it is to have collaboration. Following our meeting, I did talk to someone at Warm Springs with the tribal social services, and they were going to talk to their boss to see if it made sense for them to bring down any of the interventions that might typically happen on the reservation, from time to time at the Shelter Services Center. So I feel like as the foreseeable months go by, we're going to have more collaboration and more services being provided at the center, and that's going to be a good thing.
And Tony, we have the schedule, so would you like us to put it up on the screen? Okay.
Sure. Yeah, so I thank Heather for working with Michelle and Cindy and staff to put this together, but we've got some burn outreach specialists that are there, housing specialists that are there, harm reduction from Best Care. We've got public health represented, and they have a supportive employment specialist and case managers and that sort of thing. So this is the beginning. We'll look to see if those hours really work. What tweaks or adjustments need to be made. But the point is that there will be staff there at the center to be able to interact. What we can't control is the number of people that are there at any given point or are willing to interact with the services, but the services will be there to be provided to them should they want to participate rather.
Just a quick shout out to notice that the services that are provided are not just Monday through Friday during normal business hours. There is weekend services available, but kind of focusing on what Tony said, this is the first draft of the schedule. As we start working closer together with some of these partners, we can actually start providing full comprehensive case management and wraparound care through the partners that are directly providing those services. So this is actually a pretty exciting first step and kind of envisioning the Madras Homeless Resource Center as truly being that true resource. So exciting to see that started happening now. So.
And then just a final quick mention, we should, if not today, tomorrow, we should be going out with an offer to our first case manager for the Shelter Services Program. So that, I think there's a good likelihood of that being accepted. And so that will be exciting to begin to have case management on staff.
It's a great update.
That's great news. My own personal response to this is, one, it would be neat to see Warm Springs Behavioral Health on there. And Warm Springs Behavioral Health took 3 people out of the Willow Creek camp and moved them to Warm Springs. Either put them in the shelter or put them in rehab. So I think my point here is, while they may not be providing direct services, they can coax them back to the reservation where they have those services. And we're very effective in doing that. So perhaps changing the way you view or we view Warm Springs Behavioral Health for providing services at the shelter is needed. Maybe they're not directly providing services, but rather they're on the sideline at the end of the game when you need, the field goal. They're there to, oh, you're ready? Let's go. Boom, let's go. That's what I see the opportunity being.
Yeah, that's a great point, Nick. And I've got a bit of a working relationship with Daryl Scott, who's the program manager for their behavioral health unit. And Charmaine, Billy there and Shayla have been down here. They were very, I think, key in the camp relocation. And so I've been talking with Charmaine and I'll be talking further with Daryl to make sure again and again the invitation is really there for them to be able to participate with us at the shelter.
Did you have an additional agenda item you wanted to add?
Just an item that the mayor and I have been visiting with regarding this committee and this group. We really would like to see the focus shift a bit to work with the unhoused that are not living on the street. So the ones that are staying with friends or the ones that are living in somebody's basement temporarily and then moving to a different place and a different place. So they are folks that are struggling and needing resources, but they're not so entrenched and living on the streets that it's harder to get them to think about that next service or the next opportunity for them. And a lot of them go unnoticed because they're not coming in for services. They're kind of embarrassed where they're at. And my sense is there's probably 2 to 3 times as many in the community that are like that. And it would be great if we could work on some initiatives that support those efforts. And I don't know what that is. I don't know how to get in touch with them. Maybe it might just be enough messaging going out that they actually come in for help. But they're unhoused, but they're not living on the street. They're in that transition period of trying to figure out what they can do, whether it's a health issue, money issue, whatever it may be, but trying to find a way to support their efforts, because in my experiences working in other cities, those are the folks that you're most likely going to be able to provide the services, willing to engage with you, because a lot of the folks that have been on the street for 8 to 10 years, that's the life. That's what they want. It's really hard to get them to think of something differently. So that's what the mayor and I have been visiting about, and we'd like to see the committee talk through what that looks like and then see what we can do with the resources we have to try to support those needs.
No, I think that's a great point. I mean, there's definitely a difference between working with the chronically unhoused and in terms of their receptivity to receive services, and those that what you refer to, we refer to it as precariously housed, couch surfing and other sorts of temporary residential situations. So yeah, how to identify them and reach them. I don't know right now of any specific strategies with that, but that would definitely be a good focus if we could do so.
The other thing, Nick talked about, you guys, and I think Will did too, on trying to figure out how many low-income housing and affordable housing and those kind of things that our Jefferson County needs. And just to let you know, I called all the different property managers of the low income, the senior centers, the affordable housing, to find out what their wait lists were. And for example, Willow Creek and Madison Creek, which are low income, for a 1-bedroom, they have 117 on their wait. And they only have 10 1-bedrooms, and they have, and they don't even have any at Madison. No, they have 5, so there's 16. So, and every 3-4 months, and they have to call in every 2 weeks. Every 2 months, 60 days, they have to call in to stay on the waiting list. And then every 3 or 4 months, the property managers mail out letters to say, are you still interested? Just checking again. And if they don't answer, then they get, or they email them. And we know how a lot of people change emails, change phone numbers, that kind of stuff. Then when I talked to Adela up at Chennai Landing, which is affordable housing, and they have both 2-bedroom and 3 bedrooms. They have 24 total. They have 173 people on their wait list. And then Pony Canyon over at Madras Estates, that's for people that are 55 or disabled. There's 23 units. They have 36 on their waiting list, but they just purged a lot of people. And those people don't move unless, I'm sorry to say, most of them, if they pass away or go to a memory care. Rolling Sage, which is the new one that opened up, has it been 3 years now? I guess, 3.5, up behind Safeway by the migrant housing. Since they've opened 3 years ago, only 4 people have moved out. They're affordable housing. Now that if you're a person that goes in for a 2-bedroom, because that's all they have 23 units, it's $914. When they first started, it was $625. It's like, whoa, that's pretty heavy. But they have 38 people on their wait list, but their wait list was closed 3 months after they opened 3 years ago. It's just been closed. They had hundreds. And Jefferson Court, they have 26 units, and they have 60 on the wait list, but really they should have over 100. But they changed hands, and the last manager didn't input so many of the applications. So that's just a little bit of how bad we need housing. And even Danny that runs the Willow Creek Apartments and Madison Apartments, it's minimum 5 to 6 years out for a 1-bedroom. And so many of our people are low income and live at $943 a month or $1,000 a month. And there's 117, and that just includes their wait list. How many people out there don't even know about low income housing, but live doing the couch surfing and that kind of stuff because they can't afford to rent. But we need a lot of housing here. That's one of our reasons why we have homeless a lot. Well, a lot of them are in our program. A lot of them are couch surfing. A lot of them are staying with family. They have, the children stay there till they're, with 2 or 3 kids, and finally the parents are like, get out. I mean, there's a lot of families that have multi-generational that need places to live, but they have nowhere to go, and they can't afford to rent especially if they're on TANF or they're a single mom. So some of them are living in some really tough situations where they shouldn't be staying because, especially as I deal with the domestic violence and substance use in the house and that kind of stuff. We just lack, like every county lacks a lot of housing. COVID shut us down for a couple of years, and Ben has taken most of our housing away. So I just wanted to, if you want these numbers, you can have them.
Yeah, that would be helpful because Wednesday night, we're visiting with the council on the Housing Urban Renewal District on affordable and workforce housing. Bigger focus on workforce because none of that exists anywhere here. There is, Nick, correct me if I'm wrong, 110 units off City View that's an affordable housing project. Is that right? Yeah. So I don't know if they're 1-bedroom, 2 bedrooms or what, but it's under construction now.
But that's affordable housing, right?
Yes.
Yeah.
Tax credit. Say again? Yes, yeah, it's funded by OHCS through the LIFT program. So it's using tax credits to fund it.
Sorry, just want to go back a little bit and kind of get law enforcement perspective on this. We were talking about the hidden homeless and how do we help those and how do we do that? I'm curious, we've also talked in this committee that we need to help those that need help and we need to remove those that are causing the problems out of the equation so we can help those that want the help. So I'm curious as we talk about the hidden homeless and what we're doing, when it comes to like adults in custody that are being released into the community, are we seeing a lot of those individuals having nowhere to go? Are they just going, I know they're not all going back to the camps, but is there, as far as what you guys interact with, are there individuals that are just chronically a problem that come in and out? Or are those individuals that get out of the system and just have nowhere to go and are kind of stuck between? Does that make sense as a question?
Yeah, I mean, I would say that we have our frequent flyers, which is what it is. We deal with them, whether they're homeless or not. I don't think, I mean, I could probably pull those numbers because we do ask them when they come into the facility whether they, have a place to live or not. And so if that's something that we want to look at, I'll pull those numbers. But most people that get released from the jail, they ask to call somebody, or they have a cell phone and they'll sit out in the lobby and wait for somebody to come pick them up. Now, whether that means they have some place to go or not, I don't know, or maybe it's just a ride to give them.
Correct me if I'm wrong, Sheriff. I mean, hello, am I on? Yeah. Oftentimes, you're right. I mean, they oftentimes just want to go. It depends on also how long they've been in AIC. I mean, those that are, and what's left of their sentence. Some of the conditions of their release is they've got to have a place to go. They have to have this support network in place, and then there's this check-in period to say, all right, here's some of the goals and conditions of why you're out. You need to have a job, you need to have a place, you need to have a support mechanism, you need to have, and there's these check marks that help them move along instead of to help abate recidivism. And again, so a lot of it has to do with how long is their sentence. I mean, if it's less than a year, less than 6 months, then a lot of those check boxes aren't there. That safety net for when they get released is not there. And I mean, if it's less than 30 days, there's a whole lot of it that's not there. So it's harder to put a real fine point on whether or not it exists and how many of them are released to without having a defined place to call, as we would traditionally say, as a home or a place to go to.
Well, and we can add. And, give them the release date if we have that. Sometimes we don't necessarily have a release date right away, but give them the release date. That way, if they want that resource, that resource can come to the sheriff's office at that release date and take them and put them wherever they need to go. There is that option.
That's an exciting option. I would like to look into that. And so I know the partnership between you guys is pretty solid because if someone's going to jail, they're going into the sheriff's office jail. How about if folks from Deer Ridge are being released in the community? Is there conversation directly with you, or is that parole and probation, or how does that work?
Typically, if they're on probation or post-prison supervision, it would probably be communicated there. We do sometimes get notifications from the DA's office saying that this person's due to be released. But like Chief was saying, that I think the prison's a little uneasy close. Wife works out there, but
They have a really robust system of doing it. One of the things that they do is that they will actually take them and I guess it's reacclimate them into the environment, depending on how long they've been institutionalized. They'll take them on, for lack of a better term, and excuse my clumsiness, field trips. They've been institutionalized for 5 years. They'll take them out and reintroduce them into cell phones. They'll introduce them into public transportation. They'll introduce them into TV. They'll introduce them to the internet. They'll introduce them to computers, so that when they are released, it isn't just a simple foreign concept altogether. They reintroduced them into debit cards, money, how to actually work and live within the community. And so they do have that support network. They try and find them family networks, either whether it's faith-based or up at Deer Ridge, they have a lot of vocational training that they put them in. And so they do job sharing to put them into, and when they move out of there, that they actually go into an occupation. So I know that that happens a lot. The only time as a sheriff to speak to, we get notification when we know that somebody's being released that is going to be a registered threat in the community. We get those notifications regularly, where they're going to live, where they're supposed to report to, who their PO is going to be, the offense for which they are. They're going to be within 1,000 feet of a school. They're not supposed to be. Who their contact is. We get them from the federal level all the way down to the state level. So those are the ones that we generally receive the information from. If they're violent offenders, but most of the other people that go back out into the community, they are assimilated with friends, family, or safety network. It's been the whole idea of the governor's office for probably about a decade, is that we just don't give them a bus ticket and say goodbye.
Well, and the piggyback off that is, the two biggest, or the biggest difference between prison and the jail would be the time in which they stay there. In prison, it's years. More than a year, it's usually, they're awaiting trial, and it's a serious crime. And a lot of that is perpetuated by their own way of how they manage whether they go to trial or not. And, you know, I got people that have been in the jail for a couple of years just because their trial keeps getting pushed out, or they fire their attorney, or, you know, they just work the system the best way they know how. But most people that come into the jail are only there for days, weeks, months. So they typically have that connection, or the ability to make the connection with family members or friends or whatever throughout their stay there. At prison, they can have that connection, but I mean, you got inmates coming from all over the state, and so it's a little harder for people to, you know, keep that connection with family. So I think it's a little bit more important for prisons to be able to, you know, slowly integrate people back into the community, and have that program set up, just for their sake. But as far as the jail goes, it's a little bit different.
And one more, I'm sorry, and I'm kind of proud of my ignorance of the way the jail system works, and so forgive me for that. Just one quick, so I think we've all heard the saying, you know, you do the crime, you do the time. Are there cases where an individual is released from either jail or prison that there are no follow-ups, that you're done, you're free to be yourself, but now you have this either serious crime or something else on your record, which I think leads to difficulty finding housing and employment and all that other thing. So is it possible to be done and be done and never have to deal with the system again? And then is there a system that then supports those individuals that are already out of the system, so to speak, but need more of the services to get back in, maybe job training, but they don't qualify because of parole and probation or something like that?
Option if they need some sort of help. If they're completely out of it, like they get out of jail, not on probation. Probation usually is their next step. So if they're sentenced to probation, you know, for 1, 2, 3, 5, 10 years, or post-prison supervision.
What?
Then they have
Yeah.
then they have a PO to check in with. And I think, and I don't want to speak for the probation officers over here, but I would assume that they have some program to, you know, checks and balances of do this, do this, do this. If you don't do this, then this is the consequence. So I would say that for that, we should probably talk to full probation. One of the biggest things we run into is registered sex offenders who are homeless. You know, they pick an address and register there, you know, whether they're there or not, or, you know, sometimes they register as just homeless, which can be problematic. So,
Right. Yeah, well, thank you. Appreciate you indulging me. 'Cause I think this goes back to Will's request of the committee to identify the hidden homeless. And I think that's a population that I have zero experience working with, but I guess partnership with you and Robert over in, or Jefferson County Parole and Probation, we can figure out what that true number is and combine that with the youth and combine that with.
I think this goes back to what I said early on in this program, and what Will repeated today was there's those that want help, and then there's those that don't. And those that are frequent flyers that we deal with day in and day out, that's their lifestyle. That's the way they want to live. And no matter how many times we reach out to try to help them, whether it's best care or whether it's public health or the reservation or faith-based, it doesn't matter. You know, no matter how many times we reach out to them to try and help them, they don't care. That's what they know. That's what they want. And in my experience in law enforcement, they will not change unless that one thing, and nobody knows what it is, but there's this one thing that happens in somebody's life that flips that switch to where they decide to change. And to be honest with you, in my experience, it's pretty rare that people make that change. So.
I'll be quiet.
All right, is there any topics up for additional discussion? I just got a Teams message that there was a possible overdose center.
Yes, and I was at a medical appointment and getting multiple communications, so I haven't been back up there yet, but I believe that EMS responded. And I believe that EMS had a hard time containing the individual. So I don't know what the outcome of this was.
So is the rest of the committee okay with shifting a bit and working in that direction? I got a sense they were. I just wanted to make sure.
You know, it occurred to me while we were speaking, Will, that what you're talking about is prevention. That's what we're talking about. We're talking about maybe shifting to more of a prevention focus. I'm wondering if there's some ideas that the HLC can talk to us about prevention efforts that are going on in the Tri-County region that, you know, just from an awareness point of view, that might be enlightening for us. But that would be the shift from, you know, we'll continue, of course, to serve those that are unhoused, but what we're talking about is a shift to prevention, really, is what it is.
But not totally, because he's correct. There's a lot of people that are living, couch surfing, living in their vehicle, that we just don't know about, and the point of time doesn't find them either, most of the time. But I bet there probably could be a few at the jail, because they call them from a friend, but the friend's just picking them up to get them the heck out of there. If we could figure out a way of, you know, do you need assistance in trying to find housing? Do you need assistance in trying to find the, you know, maybe that's something we can look on trying to do for some of the areas. And FAN, that would be another group for youth and stuff, but even their families. I think it's a great idea.
background on a lot of the things that we've already been talking about, not just with the HLC, but other regional and state and Fed support as well for some of the projects that we've been talking about here. So when we get more solid stuff, you can expect something from Stacy kind of sharing what we've been working on. Yeah. Public health, not my personal assistant. Right.
So the next meeting is August 12th. Good for everyone? Second Monday?
I may not be available, but if I'm not in Mongolia, I'll prioritize being here.
I will not be here.
Cindy Potter will not be here, out of state.
I'll be absent as well.
Should we plan for August 5th instead? The first Monday of the week, of the month.
That works for me.
Cindy will still be gone, but that's okay.
Either one works for me.
Okay, I safely will move with August 5th for now. That works?
It sounds like August 5th works, Fatma.
All right, thank you.
Will you adjust our calendars accordingly?
Yes, we'll be sending a calendar invite.
Great, thank you.
All right, that's it. The meeting is adjourned.